Bismillahirrahmanirrahim. Assalamu alaikum, everybody. Ladies and gentlemen, I would like to appreciate the Shalamar Medical College for organizing this symposium under very demanding circumstances. All credit to the institution for arranging this great academic activity, and very best of luck. And I would like to start my presentation, which is on current status of surgical training in Pakistan. Ladies and gentlemen, attaining a postgraduate qualification requires a lot of commitment, hard work, and dedication. The types of postgraduate training which is available in our country at the moment is fellowship, like Fellowship of College of Physicians and Surgeons of Pakistan, master degree programs, MSMD by the universities, diplomas, and of course, foreign qualification with training in Pakistan. Our PG trainees face multiple problems. The residency program as of now is 4 years training in general surgery, 5 years in specialty. Is it really enough for the training? I think we need to ponder over. Like in foreign countries, take example of Europe and America. The minimum training duration is up to 7 years before you call it a exit examination. Now, there are certain problems which we face in this country. For example, there is non-uniformity of training in spite of best efforts by the colleges and universities. It is supposed to be structured, but it's hardly ever. To my mind, one of the biggest problems is overcrowding of PG trainees in individual units. There are too few slots. And unfortunately, we have not been able to utilize the DHQ facility for the training. CPSP has put a limit of 8 residents per supervisor, which is very high according to the world standards. But still, if it's 8, it's okay. But, in certain institutions, for example, in a 40-bedded unit, there are 60 trainees. And I think this dilutional effect is serving no purpose. Now, and then there is hardly any interdepartmental rotations in surgery, or for that matter, I'm sure in other specialties as well. Trainees are entirely focused on completing synopsis, dissertation, and training period. Apathy in organizing CME in various units is another problem identified by the PG trainees. And then there is hardly any theoretical basis of practical training. Logbook, although I think College of Physicians and Surgeons takes a keen interest in monitoring it, but still there are a lot of pitfalls. Unfortunately, in this country, there is mushrooming of armchair writers virtually in every big city. Synopsis, dissertations, master thesis, and all kinds of articles, they are for sale. Intellectual dishonesty is absolutely rampant. And research grants in this country seems to be impossible for the researchers. As we all know, the doors of American, European, British, and Australasian countries are closing very rapidly for foreign graduates. Very few candidates are being selected for training jobs, and rarely a trained doctor would return to his native country. The only reason is that they have parents who are old and they have growing children, to look after. That these are the probably only two reasons, these graduates, after acquiring a postgraduate degree in foreign countries, would return to their homeland. I had a survey of the residents asking about the problems, what they thought in their training. And, they would say there is lack of training equipment, like mannequins, etc. Exposure to recent developments, and lack of trainers. I think it's not a lack of trainers, probably. It's more a large number of trainees in a unit. That's what creates problems. And they also complained of lack of any computer facilities. And they were saying that the institutions fail to arrange their hands-on workshops. And, they say, like there are no role models, and very few would very few people make a good job of it. The duties assigned to residents, they have been diluted too. Not everything is academic related, and lack of economic infrastructure is there. They can hardly, although now the things are a bit better, but still these could be improved. And, not really very encouraging attitude of the seniors. Now, then the resident said that stipend is very low. And the supervisors, they don't seem to be committed, and they are too busy. And sometimes they also complain of favoritism to certain blue-eyed boys. Training is supposed to be structured, but it's not. Workshops before appearing in fellowship examinations, they are very expensive according to local circumstances. And few people in big institutions complained of prolonged duty hours. Now, there are problems which they face due to centralization of research and monitoring. Complaints of delayed response by degree awarding institutions is not uncommon. And lack of problem-solving attitude at regional places is also there. I think supervisors' role is very, very important in postgraduate training. There should be some kind of an incentive, I feel. And then a very humble request to the trainers that stop being mini gods. Be approachable and be available. I think we owe it to this nation. And, why should we be afraid of producing competitors? According to PG trainees, most of the supervisors, they are not interested in refresher courses or CMEs. They don't take interest in providing skills training modalities, have their own kingdoms. There are certain government responsibilities as well, like financial assistance, incentives, and scholarships and sponsorships, or skills lab training for postgraduates. Now, if you talk of a role of a higher education commission, I think they should identify training slot, have a liaison with the Royal College of Surgeons of America, Canada, Britain, Australasia to secure some training slots there, fellowships in various subjects with proper funding. Then provision of financial assistance for foreign visits, exposure, training of postgraduates, and provision of skills labs. Ladies and gentlemen, it's very easy to identify problem, but I think what we need is a strict application of rules, to sort out these problems. And the faculties should be given authority. There should be foreign exposure. There should be elective specialty training in another country. I will like to give you an example here, like in Sri Lanka. After you have done your local degree, the government sponsors your training for 2 years in a foreign country, and generally they have a liaison with the royal colleges and have these slots. And during this time, most of the people, they also do their fellowship, and then it's mandatory for them to come back to their own country. I think supervisors should be full-time professionals. I wish nobody had to do these evening practices. And, we should call them academic units rather than just a workhorse. I mean, a teaching institution should not be doing in a list 6 hernias in the morning. I think they should be doing academic surgery. I think we need to have few role models like of yesteryears. Ladies and gentlemen, all of us know the problems and their solutions. The deficiency is in commitment. Let's all trainers and trainees perform the functions as the way we are supposed to do. This is our problem. We should own it, and we should be part of the solution. I think there should be career counseling committees at regional centers. There should be lectures by pioneers, experts at neutral places like regional centers, and provision of cooperative and well-informed staff at regional centers. Ladies and gentlemen, I'm sure there must be plenty of suggestions. Unfortunately, I'll be out of the town, and I'll try to join in online to answer any of the queries that you may have. And I would like to thank you for very patient listening, and best of luck. Pakistan Zindabad.